So here you can see this is a NEET PG 2022 exam question. 32-year female presented with heavy hair loss since 4 months. She gives a history of very important COVID-19 8 months back. So what is the most likely diagnosis? If in case you have marked it as telogen effluvium, absolutely our answer is correct. And I will leave the link for this recall questions of NEET PG 20, the question which you want to listen to. And telogen effluvium, basically it is a transient condition where the treatment is going to be wait and watch, and there need not be any medication which can be given to the patient. Why? Because this telogen effluvium, it will resolve spontaneously. Spontaneous resolution is a feature of this. So first of all, what is this telogen effluvium? So effluvium simply means shedding of, and telogen effluvium is the name given. Why? Because in the hair, if you know, there are three important phases: anagen, catagen and telogen. I have explained this in this video and the iCard here. So anagen hairs constitute 85% of the all the hair follicles in a person's body. So this gets converted, this is the anagen phase, is the growth phase. This gets converted into catagen phase, which is a transitional phase, and ultimately this will convert into telogen phase, which is a resting phase. And ultimately this telogen phase, it will shed off after 3 months duration. So also remember one more numerical: anagen phase, which is the growth phase, the hairs will stay over the body for a period of 3 years. So in patients who are having any of these conditions, like for example a person undergoing major surgery or going through major illness, because of which there will be stress hormones released, like for example chikungunya, dengue fever, typhoid fever, or even COVID-19, and not only that, even pregnancy, major surgery, or myocardial infarction, and chronic disorders like for example iron deficiency anemia or hypothyroidism. In all these individuals, anagen phase hair is going to convert into telogen phase, and because of which after 3 months duration. Why? Because telogen phase hair can stay over the body for a period of only 3 months. After 3 months of any of these illnesses, the patients are going to experience a tremendous loss of hair, and this is given a name called as telogen effluvium. So if in case you are having some doubts regarding this COVID-19 telogen effluvium, you can check out these articles. I will leave the link for this in the comment section and in the description below. So that's it in this video, friends. So I hope you have liked this video. If you are having any more questions, signing off. Happy learning. Sarvam Sri Krishnarpanam Sarvechana Sukhino Bhavantu. Thank you so much.